AM 1450, FM 99.3 KNSI. Welcome to Your Health. Produced in conjunction and association with CentraCare. Today, ladies and gentlemen, we are going to talk about mental health issues, specifically suicide, and more importantly, suicide prevention. Dr. Ryan Engdahl in studio with us, as is Lisa Bershok. Lisa is the Suicide Prevention Program Manager at CentraCare. Welcome, you two. I appreciate you joining us today.
Thank you for having us.
The first question might surprise a few folks. CentraCare is responding to suicide in our communities. What is CentraCare doing? Doctor?
Yeah, Bob, thanks. We at CentraCare are aware, as other agencies are in the community, is that the rates of suicide in the country and in our state are on the rise. We recognize the need to create a formal approach to how we're addressing suicide and the rising rates in our communities. As a mental health service, we've incorporated assessment and treatment of suicide historically, and we've recognized that we have an opportunity to be a resource for the community as well.
Dr. Engdahl, I know that doctors talk. I know that different hospital groups get together, conferences across the country. Is this something that has been, I don't want to say dictated, but has it come down from, let's say, the American Medical Association or another governing body that says, hey, we've got a problem in this country. Everybody needs to start paying attention?
I wouldn't say it's come down as a mandate, but absolutely every system in the country is aware that suicide rates are on the rise. And there's encouragement for addressing this head on and directly in ways that maybe we haven't before.
All right. There's a very special effort that is being made. The CentraCare Foundation Community Year-End Campaign will be focusing on suicide prevention and education. What do we need to know about helping people prevent suicide? Lisa?
I think one of the most important things that we need to discuss in our communities around suicide prevention is addressing it directly. Being able to feel comfortable having conversations with our family members, our friends, our coworkers, when we maybe see warning signs of suicide. Being able to be open and have, direct conversations to be able to ask them kind of what's going on in their lives, how they can support them, and if they feel that there could be at risk of suicide, being comfortable asking that question directly. Sure.
I think we've all either read or known someone, read about or know someone that may have committed suicide. I'll tell you, the one of them that impacted me the most was Robin Williams. And I said to myself, why didn't he call me? Now, obviously, Robin Williams is not going to have my phone number. I get that. But that's really a common response, right? Why didn't they say something? Why didn't they talk to me? That was my friend. I would have loved to have helped them. Is there an answer as to why people who do take their own lives, why they just don't reach out to get that help? Sometimes
it's related to stigma. Individuals might be having these thoughts of suicide or might be experiencing maybe either mental health symptoms or a number of life stressors. And they feel isolated from family and friends and coworkers. How do they talk about this? The stigma that even they might themselves have, that self-stigma that if I talk to somebody about this, they might think that I'm crazy.
Yeah, they're going to think I'm a nut.
And so one of the things that I think suicide prevention education and awareness can do for the general community is as more individuals become trained to be able to learn how to talk about this, is you can directly ask the individuals in your life how they're feeling, how they're doing, and ask directly about suicide. We know that asking will not put that idea in someone's head. What happens is when you can ask directly is you become a safe person for that person to talk to.
Okay.
And it allows them to have an ability to open up, to know that you're safe and they can express things to you that they may be feeling or thinking. And in turn, if you know how to connect them to help and resources in the community, we've, as a community, as individuals and family systems, we've taken steps then towards helping that person because we know that mental health symptoms, we know that suicidal thoughts are treatable. And if that person is able to get connected with the right help, they can go on to live full and engaging lives.
Folks, I hope you just heard what Lisa said. Because if you are thinking of suicide, you don't have to go that route. That help is there for you. Lisa, I just want to toss this out. If someone is struggling with, or maybe you are supporting someone who is struggling with thoughts of suicide, the National Suicide Prevention Lifeline, 800-273-8255. Again, 800-273-8255. You can text MN to the number 741-741. Now, Doc, I have to ask you this. If we look at a scale of 1 to 10, and we don't want to get past 5, and we're dealing with suicide, this epidemic, and I'm going to call it an epidemic. I'm not a medical guy whatsoever. Sure. But, I mean, obviously we have a problem or we wouldn't be having this conversation, right? So on a scale of 1 to 10, are we at a 3, do you think? Are we at a 5 in our country? And for gosh sakes, how did we get there?
Well, Bob, suicide is the 10th leading cause of death in the country, and it's the 8th leading cause of death in Minnesota. So I don't know how we'd rank that on a scale from 1 to 10. But what I think we know is that we have a tremendous opportunity to provide education so that we can intervene earlier. I think, to your point, is the sooner we can get connected with folks, and as Lisa spoke about, the sooner we can become involved and the more aware people are of the resources they can get access to, the more people we're able to connect with and help. As you mentioned earlier, it's hard to talk about, and so our goal is to help people find the ways to ask the people who they care about if they can support them. We're trying to provide avenues for people who are struggling to reach out to the right resources, and also provide a resource for those people who are concerned about somebody around them. We talk about crisis response and crisis resources in our community as being available for people who are struggling themselves, but also for their caregivers and for people who are concerned about their friends or family.
I think of the instances, again, that we have heard of suicide happening, and we go back, if they just would have said something, and to Lisa's point, you have to ask. And if this conversation today and the ensuing conversations that we are going to have, if it becomes, golly, you don't want to say comfortable, right? But that's kind of where we're going to try to make it more comfortable to even talk about this.
Absolutely, Bob. I think the goal is that we make it comfortable to talk about. We make it something that families can talk about at the dinner table, because if we don't, we will continue to have sort of the same problem. We have to essentially give people the tools to make this something that is very simple to discuss.
So I did not know, and again, what Lisa said earlier, it's preventable if we can start talking about it. I didn't know that, right? So it's that simple. It can be that simple. Breaking down some of those barriers. Again, breaking down some of those stigmas regarding mental illness. Suicide prevention is our topic today on Your Health. Dr. Ryan Engdahl and Lisa Bershok, Suicide Prevention Manager, our guests from CentraCare. We'll take a quick break. When we come back, again, we're going to talk about breaking down some of those stigmas regarding suicide. This is Your Health on KNSI. AM 1450, FM 99.3 KNSI. Welcome back to Your Health, a very touchy subject today. Suicide and suicide prevention. Dr. Ryan Engdahl from CentraCare is in studio. Lisa Bershok is their suicide prevention program manager. Guys, we were talking about breaking down some stigmas regarding suicide and suicide prevention. And I wonder, can we look back at some other things that have happened in the medical profession where we have brought up this topic, where we have broken down the uncomfortability factor, and now we talk about things like this all the time, but we don't do that with suicide prevention. Lisa, what do you think?
I think suicide prevention has started to work from a public health model, very similar to the work that's been done with tobacco cessation, very similar to the work we do around drugs, alcohol, vaping is in the news recently. And so, very similar to those topics, as we start educating on the risks, as we start educating on how we can come together as a community to reduce those health risks, the same for suicide and suicide prevention. So, for example, once upon a time, decades ago, parents didn't probably talk to their kids about the dangers of drugs and alcohol. But now we say, talk early, talk often. Yeah. And the same has to be for suicide prevention. And the same way that parents once upon a time didn't have enough education to really know, how do I bring this subject up? What's too early to talk about this? Yeah. How do I talk to my children about this? We know the same will be for suicide prevention as we continue to do more of that public health model, educating in the communities, educating in schools, coming into workplaces. 70% of everyone who dies by suicide is of working age. So these are our coworkers, these are our friends, these are our family members. And so the more we can do to bring this conversation out in the open in all of those avenues, we know very similarly we'll find ways to make sure that individuals are trained well enough to spot the warning signs and get their loved ones connected to help.
Think about what Lisa is saying, folks. We talk about cancer. We have cancer walks. We raise awareness. We just did an amazing thing for Alzheimer's and Alzheimer's research. Doc, what are your thoughts on all of this? You blew me away with that statistic that suicide is the 8th leading cause of death in Minnesota. We have to change that.
I agree, Bob. And I think we look at our charge as being a resource for the community. As Lisa said, is getting the information in front of the right people is what our goal is. And our hope with this program is that we become that resource for our community, that people can call us and say, I would like to get some information for my workplace or for my group or for my church or for this event we're having. And we can be there to show up and provide consistent, appropriate, and accurate information and training.
What happens? And obviously, we can't talk with someone and say, what made you do this? But what do you know about events that lead up to someone actually going through and committing suicide? What can you tell us, Lisa?
Well, individuals who die by suicide, oftentimes it's not just one triggering event. That's kind of a myth that we have, that there is one event that leads to this. Oftentimes it's a combination of life stressors, mental health symptoms, family histories, personal histories. And so what looks to us as family members or community members as one triggering event is actually kind of a long process of individuals struggling to cope. And so we also know in terms of suicide prevention, talking about it, doing the anti-stigma work so we feel more comfortable about this as a community is helpful. But we also need to get in front of the crisis. We need to start doing early intervention. And so when we see that somebody is struggling with mental health symptoms, that we as, a culture, as, Central Minnesotans, that we have the ability to say, it is okay to get support and help. It is okay to go to therapy to learn how to cope with something that you've never experienced before.
Let's go way back to mental health as a giant umbrella, right? Because there's a lot of different parts to mental health and being healthy. Doc, where does all of this factor in? Suicide as opposed to depression, as opposed to maybe some multiple personality disorders or some of the other mental health issues that we all have to deal with?
Yeah, one thing we talk about a lot is mental well-being and how mental health exists on
many different levels.
Right.
Oh, my.
There is. And so
from being a parent, your first-time kids, to, child number 3, no big deal.
Absolutely.
Right?
Absolutely. Mental wellness exists on a spectrum. And so we talk about these things existing in various different places. There's mental illness and mental health, and suicide is part of all of these things. And our goal is to help support people recognize that this is part of your whole health. Your mental health, your mental well-being is part of who you are as a person. And how do we support that whole person care?
So are we starting to learn more about that whole package? Being a well person is so much more than just, not being 30 pounds overweight?
Absolutely. Our focus, again, is mental well-being as a whole person, and instead of separating your brain and your body, we recognize that those are one unit working together.
A whole person. I was just thinking about what I said about raising kids, right? When you have that first child and you bring him home, oh my God, you're just freaking out. I'm going to break him or something, right? Well, look at all of the opportunities for education that we have when it comes to talking about children and their being born and their health and all of this, the vitamins and, the vaccinations that they have to do and all of these things. Well, mental health is no different than that. It is different, but it's yet the same.
Yeah, you make a very good point. So the first time someone is going through pregnancy, they learn a lot and they're exposed to a lot of new things, and we bring them in and we show them the ropes, if you will. And you make a good point is how do we do that with suicide and suicide prevention? Is how do we bring somebody into something they might be experiencing for the first time and provide them with a boatload of resources so they can learn how to take care of themselves?
Lisa, he has just asked a very important question. What do we do? What are the tools that are available out there for us to start talking about suicide and Who should we be talking to? Younger kids? Is there an appropriate age to discuss mental health?
Well, I think that conversations around mental wellness, brain health, so to speak, those are things that we can infuse into our children's lives from an early age. Talking about how important it is to be able to express your feelings and have a safe avenue to do that. And I think as parents, to be able to acknowledge that if our child is struggling to cope with some things that are more difficult for them, that it's okay to talk to your pediatrician about whether or not mental health support is helpful. Again, what we know is that for most individuals, that half of all mental health symptoms will present by the age of 14 and 3/4 by the age of 24. And so we also know from the time somebody has symptoms of mental health related diagnoses, from the time they start symptoms to the time they get connected with care, is 8 to 10 years. It's 8 to 10 years of somebody dealing with those symptoms.
Yeah.
And within that, then you can get to a point where you could feel hopeless, that it's too difficult to deal with. So again, we know early intervention, whether you're a child, an adolescent, an adult, and so when you say who should be talking about this, we should all be talking about this, because there is no specific age, gender, or nationality. I mean, internationally, everyone has stressors and anybody can die by suicide. And so what we want to do is create these conversations. And I think the earlier we can start talking about this, for example, I recently attended a high school production that focused on mental wellness and suicide prevention. And there was a lot of grandparents who showed up, right? It's kind of in the middle of the day at the high school. And, grandparents came up afterwards to talk to the kids who had been involved. Not only were they saying, "I'm so proud of you," right? Yeah. Like you expect grandparents to do. Some grandparents, I saw tears in their eyes and saying to their grandchildren, saying, "I'm so glad we're talking about this. We need to talk about this." So I think this sense of, saying, "Oh, well, older generations are not as invested in this conversation." That's not the case either. When we start giving people permission to talk about this, everyone has a story. They have their personal story. They have the story of somebody that they love and care about. And that's why it's so important to bring this out into the community.
And when you turn it over to kids, man, they're going to take it and run with it. I think that is so spot on to bring it up with those kids. They know. They're experiencing this. Dr. Ryan Engdahl is our guest, as is Lisa Bershok, Suicide Prevention Program Manager for CentraCare. And again, my friends, what you need to know is the Suicide Prevention Hotline, the Suicide Prevention Lifeline, 800-273-8255. Again, the National Suicide Prevention Lifeline, 800-273-8255. You can text the letters MN to 741-741. You are listening to Your Health. We'll be right back. KNSI. AM 1450, FM 99.3, KNSI. You are listening to Your Health, and the topic today, suicide and suicide prevention. Our guest experts, Dr. Ryan Engdahl and Lisa Bershok. She is the Suicide Prevention Program Manager at CentraCare. Lisa, things are changing when it comes to attitudes on how to discuss this.
They are. I think as we have more voices of what we call live survivors, people who survive suicide attempts, when we have suicide loss survivors coming and sharing their voices and their experiences, things as I know you had mentioned earlier, you talked a little bit about Robin Williams. The term committed suicide, we're changing that language. Language has an impact on our culture and how we think about topics. And so when we talk about suicide, we talk about people who have lost their lives to suicide, people who have died by suicide, mostly because once upon a time in this country, it actually was illegal to attempt suicide, and you could be arrested if you survived. And so what we want to do is talk more about how early connection to treatment can give people hope and options for how to survive a suicidal crisis. We also want to focus more on the fact that there is hope as a community, even when deaths by suicide occur.
Now, we know what we should do, okay? How about warning signs? What do we know what to look for when it comes to warning signs? Someone in the family, maybe even myself, may be thinking about this. What do we do?
Yeah, I think some of the things that can be helpful is, one, attend a suicide prevention training in your area. CentraCare will be, through our suicide prevention program, offering trainings for free to your community groups, schools, faith leaders, and other workplaces in the community. But things that people can look at for are warning signs of suicide might be somebody feeling hopeless, feeling trapped, like there's no way out of their situation. You might see some pretty dramatic mood changes that are not normal for that person. Maybe, rage or uncontrolled anger. Increased drug or alcohol use can be a sign. And especially withdrawing from family, friends, workplaces.
Things we used to find enjoyment with, we just don't do them anymore?
Absolutely. And so those are what we call indirect warning signs. That person might be at increased risk of suicide, but may not be suicidal. But this is still something you should pick up on and start the conversation with your loved one on.
What about a direct warning sign?
Exactly. And so those are what we call emergency warning signs. And these are, if you see these with friends or family, you need to take them very seriously. You need to connect them with help right away, which could be connecting on a health and welfare check with your local police department. It could be connecting them with behavioral health assessment immediately, oftentimes maybe through an emergency room. But these direct warning signs is somebody actually threatening to hurt or kill themselves or talking about wanting to die. It could be looking for ways to kill themselves, searches on the internet, or trying to get access to a weapon. Again, things that are outside of the norm for the person that you know. And either that or somebody talking or writing about death, dying, or suicide. And those you need to immediately connect somebody with mental health support and assessment.
You know someone, if this is striking a chord, think of this. The National Suicide Prevention Lifeline, 800-273-8255. Text MN to 741-741. Dr. Ryan Engdahl and Lisa Bershok, thank you so much for spending your time and sharing your expertise with us today.
Thank you very much.
Bob, it's our pleasure.
You have been listening to Your Health, AM 1450, FM 99.3, KNSI.